Hello. So today I'm going to talk about palliative care. Okay. So most of the time when I have attenders and I go home to see patients, elderly patients with the terminal cancer and things like that, okay, they are not really, convinced about what kind of care they need. They are like, sir, we want pain relief. We want her to be happy. So I tell them, see, making her happy, making her comfortable is not the only criteria, is not the only plan for palliative care. So giving them a quality of life, giving them a life where they can still walk around, do something independently, is also giving them palliative care only. But at the same time, how much do we keep them pain free? How much we keep them dependent on themselves? And how much we prevent complications? See, most of the time I tell them your cancer does not kill, but the complications associated with the cancer is the one which kills them. So, for example, they have metastasis in the lung, or metastasis in the brain, metastasis in the spine. All these can be more debilitating than the cancer itself. So, how do we handle all these things? How do we make sure they don't get into complications with all these problems? So, for example, any lung metastasis or any brain metastasis can give them recurrent infections in the lung or seizures or bleeding inside the brain. Okay. Similarly, a spine meds can give them paralysis of the legs and difficulty walking, making them understand about all these complications and helping them to avoid these things, or helping them to cope up with this kind of deformity is the main thing about palliative care. So once I make them understand, okay, this is what you need to do, this is what you can help yourself to prevent. Okay. So once that stage is reached, so once that kind of understanding is reached with the patient and the attenders and the caretakers, definitely I think we can educate them better and help them to cope up with the palliative care that they need. Thank you.